Okay, now in this segment what we're going to do, we're going to start working on individual bones, major bony landmarks of the body. We're going to start going from the top to the bottom of the skeleton, so naturally we would start with the skull. Okay. Now what I'm going to do here is I'm going to show you an illustration of these bony landmarks so you can kind of see these colored highlights to get a good image of where these bones are located, and then we'll go over to the skull itself, as you can see propping this page open, and then I'll show you right where these landmarks are on here. Now this book that we're using, this is Dr. Netter's Atlas of Human Anatomy, the 4th edition. It's an excellent book and an excellent resource. Okay. So first, let's talk about how many bones are in the skull. There are 22 bones total within the skull. Okay. Now there are a few different cranial bones. There are 6 different bones that make up the cranium. Now the cranium is where the brain itself actually sits and rests in. Okay. And a lot of times we would call it the cranial vault. Okay. Now there are a few different bones that are on the superior aspect of the cranium. We'll give those attention first. Okay, first, as you can see, this very blue highlighted area, that is the frontal bone, and this is the bone that makes up your forehead, and also that covers the frontal lobe of your brain. Okay, and then next, you see the green on the superior lateral aspect of the skull. That would be the parietal bone. Okay, so as you can see, there's only one frontal bone, but there's 2 sets of parietal bones. Okay. And each parietal bone covers the parietal lobe of the brain. And the parietal lobe is what's responsible for interpreting what we like to call somatosensory information. Okay, senses that come from your body. All right. And then if you go down just a little bit more, you can see the temporal bone in red. Okay. Now the temporal bone is on the lower, you can say the inferior lateral aspect of the skull. Okay. Now there's a few different landmarks that are going to be worth mentioning on this, okay? And I'll show them to you when we actually get to the regular skull itself. But the temporal bone covers the temporal lobe of the brain and plays a very large role in hearing, smell, and memory, okay? And this is also where the ear is located, okay? And then next, you can't see it on this picture because this is just an anterior view. The 4th and final lobe would be the occipital lobe, okay, or the occipital bone, I'm sorry. And the occipital bone covers the occipital lobe of the brain. Okay, now the occipital lobe is on the posterior and inferior portion of the skull itself. So this is the area that's protecting your visual centers of your brain. This is helping to protect the brain stem. This is where the spinal cord exits your brain. So this is a very vital area of the skull itself. Okay, so these are the 4 superior bone, or not 4, I'm sorry, but these are the 4 different superior bones of the cranium itself. So we have 1 frontal bone, 1 occipital bone, 2 temporal bones, and 2 parietal bones. Okay? Now, if we go to the lower portion of the cranium, again, we can't see this for now in this picture, but I'll show you these bones when we actually look at the skull. There are 2 separate bones. One is called the ethmoid and one is called the sphenoid. Okay, both of these, the ethmoid, it makes up the upper 2/3 of your nasal septum, and then the sphenoid bone takes up a big chunk of your orbital cavity, as you can see here, and also makes up most of the floor of the cranial vault itself. Okay, and then all of those bones put together, we get the cranium, the area where the brain actually sits. Okay, and then we can work our way down to the lower portion of the skull where the facial bones are located. Okay, now facial bones are irregular bones. You can't put a shape to them. They're just irregularly shaped. The cranial bones are flat bones. Okay, now let's talk about these different facial bones. Okay, right here you can see this is the nasal bone, and there's a little separation right down the middle of this, so there are 2 nasal bones. Okay. And both of these obviously make up the bony portion of your nose. And then the rest, where you see this open cavity here, that's cartilage. Okay, that's just connective tissue that's supported by epithelial tissue, your skin. All right. And then, if you look down into the nose itself, you can see that there are these little kind of curved-looking bones. Those are called the inferior nasal concha. Okay, the inferior nasal concha. And then up here you can see there are some bones that are similarly shaped that are part of the ethmoid called the superior nasal concha. Okay, these bones are nicknamed turbinate bones, okay, because when you breathe air into your nose, what happens is air swirls around in between these bones and then is propelled towards the posterior side of your nasal cavity, where it then comes in contact with a good thick mucus plug so you can filter air as you breathe it in. That's called inertial filtration. Okay. Now next, you can see this big green landmark here. That's the maxilla. This is the upper portion of your jaw. Okay. And you can also see that your maxilla also makes up a small portion of your orbital cavity as well. Okay. So this is a non-movable portion of your jaw. And then this little pink portion here, this is your lacrimal bone. Okay, your lacrimal bone. Okay, in your lacrimal bone, basically, you have tear glands, and then there are ducts located within these, they're called lacrimal ducts, that are located around the vicinity of this bone here that drain into your nasal cavity. Okay, and then we work our way down, and then notice, let's kind of keep our focus around the upper part of the skull right here. And see this little pink highlighted area? That's a bone called the vomer. Okay. Now as you can see, you have the ethmoid bone right here, and you have the vomer right there. Okay. The vomer makes up about the lower quarter, lower third of the nasal septum. Okay, and that's about all it really does. And then as you can see, the ethmoid bone makes up the rest of the nasal septum. Okay, and you can feel that septum in your nose that separates your airways. Okay. And then next, you can see you have the cheekbones, which are technically called the zygomatic bones. Okay, the zygomatic bones articulate with what's called the zygomatic process of the temporal lobe, and then form what's called the zygomatic arch. And there are various muscles of mastication and facial expression that are attached to this area. Okay, and then if we work our way down, we can see, you know, the last bone of the skull that we haven't talked about yet is the mandible. Okay, the mandible is the lower portion of your jaw, and this is the only bone in your skull that is freely movable. Okay, it's the only bone in your skull that's freely movable. All right, and your mandible can be broken down into a couple different parts. Okay, it has a ramus, a body, and a mental protuberance. Those are the landmarks I want you to know. Okay, the mental protuberance is your chin, the body is the main bulk, and then you have the ramus that works the upper angle that works its way up to the point of attachment. Okay, and the last bone I didn't mention, was the hard palate. Okay, the hard palate makes up the about the upper 2/3 of the roof of your oral cavity. Okay, so we use that for, you know, if we need to chew food, we can press food up against there. Okay, so these are the major bones of the cranium itself. Now let's kind of shift our focus down a little bit and talk about the bones that make up the orbital cavity. Okay, there are 7 different bones that make up your eye socket. It's not just one bone. Okay, so basically there are 7 different bones of the skull that eventually fuse and articulate together to form the cavity of the eye itself. Okay, so first, as you can see here, the blue, if you remember from the picture above, is the frontal bone, and the frontal bone makes up the superior aspect of the nasal cavity. Okay, and then you can see here the zygomatic bone. Okay, the cheekbone makes up the lateral portion and some of the inferior portion of the orbital cavity. Okay, and then you have the maxilla. Okay, the maxilla also makes up, you know, the inferior and medial, and like the lower medial inferior portion of the orbital cavity. Okay, and then the lacrimal bone makes up the medial portion, I mean pretty much the medial portion of the orbital cavity. Okay, and then the ethmoid bone. Okay, this is called the orbital plate of the ethmoid bone. This is a flat plate that sits on the inner aspect or medial aspect of your orbital cavity. And then last but not, and then I forgot to mention the hard palate. Okay, now the hard palate makes up just a tiny little smidget of your orbital cavity, but it still protrudes up into the area, so it technically forms a part of your eye socket. And then last but not least, the sphenoid bone, as you can see this yellowish color here, okay, is the sphenoid bone. Now these are all the bones that make up your eye socket or your orbital cavity. Okay, the frontal bone, zygomatic bone, the maxilla, lacrimal bone, the ethmoid, or the orbital plate of the ethmoid, okay, the palatine bone, or the orbital process of the palatine bone, and the sphenoid bone, okay? And this is part of what's called the greater wing of the sphenoid bone, okay? So these are the illustrations of these landmarks. Now let's actually take a look at these landmarks on the skull itself. Okay. So first, let's examine the cranial bones. Okay. Now we'll look at this from the anterior view. So first we have the frontal bone that makes up your forehead. Okay, and again, there's only one frontal bone. And then let's look at the other, only one bone of the cranium, or of the outer portion of the cranium, I should say. We have the occipital bone. Okay, so you can see the occipital bone is on the posterior portion of the skull, and then makes up a very large portion of the inferior aspect of the skull. Okay, and this landmark right here, this is called the foramen magnum. Okay, the foramen magnum is where the spinal cord exits the skull and then travels down the spinal column. Okay, and then you have these occipital condyles here. And these kind of rounded processes, these sit right on atlas, the first cervical vertebrae. Okay, and this forms a joint, so that when you want to create movement, this joint with the occipital condyles and atlas allow you to do this motion. Okay, flex and extend the neck. Okay, now if we look at the lateral portion of the cranium, you can see the parietal bone up here. Okay, remember there are two parietal bones. And then let's kind of look at this from a lateral inferior point of view, and then you can see the temporal bone. Okay, now the temporal bone, there are a few landmarks that are necessary to know on here. Okay, one would be this opening right here. This is the external acoustic meatus, or the external auditory meatus. Okay, either way you call it, it's fine. Okay, but there are just a couple different names for this area. Now this is the opening to the ear canal, and as you know, the ear canal runs right into your temporal bone, and then this is where we process auditory information, hearing information. This bump, this bony landmark here, is called the mastoid process. Okay, and this is where the sternocleidomastoid muscle originates. Okay, or inserts, I'm sorry. Okay, and then you have the styloid process down here for muscles of mastication to originate and insert on. And then you have the zygomatic process, okay? And like I said before, the zygomatic process works its way over towards the zygomatic bone. And where the zygomatic bone, or the cheekbone, where these two meet, forms what's called the zygomatic arch. Okay? Now let's look at the internal bones of the cranium. Okay? Now, as you can see, you kind of have to have a little bit of an imagination for this, but you can see the sphenoid bone. This would be called the lesser wing of the sphenoid bone. These projections work their way towards the posterior portion of the skull. And then you have what's called the greater, the thicker wings of the sphenoid bone. Okay? And then right in between both of these wings, there's a thick body that makes up the sphenoid bone where these two wings attach to. And then you can see there's a little groove right here. Okay, this groove is important to remember and understand because this is called the sella turcica. Okay, and the sella turcica sits just underneath the frontal lobe of your brain. Okay, and then just underneath the frontal lobe of your brain is your pituitary gland. Okay, so the master gland of your body is sitting right here within this groove of your sphenoid bone. So that's important to remember. And then here we have the ethmoid bone. This is what we call the cribriform plate of the ethmoid bone. Okay, so basically what happens here, there's a specialized sense organ, okay, called the olfactory bulb that sits right here. And then there are all these little nerves. You see these little holes right here? They're called foramina. Okay, they're called olfactory foramina to be specific. So then all your little nerves, that make up your cranial nerve number 1, protrude down into your nasal cavity through this area and then embed themselves within the mucous membranes, okay? And then what happens when you breathe air in, those odor molecules come in contact with the nerves that are protruding through here. It stimulates them, excites them, and then we send information to the brain to be processed, and that's how we get smell. So this is the ethmoid bone right here, this little bone right here, and then we have the sphenoid bone. And then all these bones put together make up what we call the cranial vault. Okay, this is the area where your brain sits. All right. So now let's move down to the facial bones. Oops. That. Okay. So now we're down to the facial bones. First, again, we have the nasal bone. This makes up the upper ridge of your nose. And again, you can see there's a little suture down the middle here, and you have two separate bones. Okay. Then you have your zygomatic bone, your cheekbones. Now it's really hard to see on this, but see this area where there's this little hole right here? Okay. And then and the bone that's right about here, that's your lacrimal bone. Okay. And like I said, when you shed tears or when you cry, there are lacrimal glands on the lateral portions of your eye. Tears travel from lateral to medial, and then what happens are the tears work their way down what are called lacrimal ducts and then drain into your nasal cavity. Okay, and the whole point of creating tears on a regular basis is to wash your eyes and keep them clean. Okay, and then if you look at the inside of the nasal cavity, you can see the nasal septum here. Okay, and like I said, about the upper 2/3 of the nasal septum is the ethmoid bone, and you can see the superior nasal concha, or the superior turbinate bones. Okay, and then the lower portion of the nasal septum is called the vomer. Now, the vomer looks a lot like an old-fashioned farmer's plow. Okay, and then you can see the inferior nasal concha that originates somewhat on the maxilla and then protrude into the nasal cavity as well. And like I said, when we breathe in, air hits these bones, kind of spins around, and then gets projected towards the posterior aspect of the nasal cavity. Okay? And then we have the maxilla, the upper non-movable portion of the jaw. Okay? And then we have the mandible. Okay? This is the only bone in your skull that should be moving. Okay? And then let's flip this over a little bit, and you can see right here, this hard and bony structure up here, that's your hard palate. Okay, that's your hard palate. Then again, let's quickly re-examine the orbital cavity. You have the frontal bone, makes up the superior portion of your orbital cavity. You have the zygomatic bone, the maxilla, lacrimal bone, ethmoid bone, the sphenoid bone. And the hard palate, which you can't quite see distinctly here, but the hard palate would be the last or seventh bone of the orbital cavity. Okay? And this concludes the skull.